Healthcare Research and Quality estimates nearly 53,000 people have shoulder replacement surgery every year in the U.S. Dr. Brian Werner from the UVA Orthopedics Department is here for today's house call to talk about something called reverse shoulder replacement. So explain what that's about.
So reverse shoulder replacement is a little different than standard or conventional shoulder replacement. Reverse shoulder replacement was first introduced in the United States in 2003, although it had been used for a decade or so prior in Europe. And the difference between reverse shoulder replacement and regular shoulder replacement are the indications that you use it for and then the way the shoulder replacement is done. Reverse shoulder replacement in particular is used for patients who have arthritis but also don't have a rotator cuff that's working.
Okay, that sounds like a long, drawn-out procedure. Tell me a little bit about the surgery itself and what is the recuperating time? How long does it take before somebody can actually move around again?
Sure thing, good question. So reverse shoulder replacement, the reason why it's called reverse shoulder replacement is because during the procedure, you actually put the ball on the socket side and the socket on the ball side.
Oh, wow.
And the reason why you do that, and that's why it's reversed, because you're doing it backwards, the reason you do that is to allow patients who don't have a rotator cuff but do have arthritis, allow them to move their arm better and actually use their arm without a rotator cuff. Then as for your second question, recovery for reverse shoulder replacement is very similar to recovery for standard shoulder replacement.
Okay.
So about 1 day in the hospital, you start physical therapy about a week after you have your shoulder replacement, 4 to 6 weeks in a sling, although you can come out of the sling for rehab, and then usually a couple of months before you can get back to most of your activities. And we anticipate people get back to most of the activities they want to, including light sports.
So that is the way that it is different. So will they be able to have full capabilities that they had before?
Absolutely, that's the goal. So there's actually been very good research that shows that people that have reverse shoulder replacement get back to most sports within reason, of course, that they are interested in doing.
All right, that sounds great. Doc, thanks so much for coming out today.
Thank you very much for having me.
We appreciate it.